The General Secretary of the National Education, Health and Allied Workers Union, NEHAWU, has commended government for its transparency in dealing with the COVID-19 pandemic and also the country's vaccine rollout program. And this following information that the AstraZeneca COVID-19 vaccine had been halted because it is not particularly effective on South Africa's 501YV2 variant. Now, NEHAWU has also urged government to consider procuring other vaccines as a matter of urgency. To discuss these issues further, we're joined by Zola Saphetha, who is the General Secretary of the National Education, Health and Allied Workers Union. Thanks so much for your time this morning, Mr. Saphetha. Welcome to Morning Live.
Good morning to you and the viewers, and we appreciate the opportunity.
So if we could officially just first gauge your reaction to the decision to halt the rollout of the AstraZeneca COVID-19 vaccine at the moment.
In fact, I must say that we are highly disappointed as frontline workers as a result of that. There's a general anxiety because we have been really ready to be vaccinated and looking forward to that. But of course, government had to do the right thing to tell us the implications of or the ability of the vaccine in terms of responding to our expectations. So we welcome that and we applaud government for doing that. But generally, we are once more disappointed because we are looking forward.
Disappointed, but how has it impacted the mindset and, of course, the willingness to actually be inoculated on the part of healthcare workers? Because one reads a lot on social media, you kind of get a sense of where at least part of the public's heads are at. But how has this impacted healthcare workers, frontline workers specifically?
It's very badly, and because Sakina, it's very bad because you will remember that NEHAWU spent time in December and January persuading frontline workers, particularly healthcare workers in general, amidst the distortions about the vaccine from the health experts, to a point that they had accepted and willingly looking forward to receive the vaccine. You know now, having been persuaded, and also there's this bomb that has been dropped about the efficiency of the vaccine, and that really is going to take us back to persuade. In addition to that anxiety, they lost hope on their part. So we have to do some serious work as a union to once again persuade them, and it has never been easy, because others, they've been understanding the vaccine as something that will transform them to baboons, and others with side effects that were distortion. So to go back again, speak about the efficiency of the virus in the context of the lack of information on the new variant that frontline workers are confronted with. So it's going to be a mountain to climb.
You know, Mr. Saphetha, when you say that healthcare workers labor under notions that they could, after taking the vaccine, turn into baboons, is very worrying. You know, what does that say about the healthcare workers themselves? Because one would imagine that they would be at the forefront of telling us why we should get vaccinated and why these inoculations would be good for us. If they believe such, one could say, outlandish stories, where does that leave the rest of us?
We must appreciate the fact that this is a global crisis, and we were not have been exposed to this kind of a virus. So it needed a lot of education, not only to society, but also to frontline workers. And two, when the distortion is led by health experts, the so-called scientists, what do you expect to those who are just touching the body, who might not be equipped to be at that level, the advanced level of understanding the actual impact of the vaccine? So we must take into account of those realities, but it shows the extent to which we keep healthcare workers abreast on the nature and the pattern of viruses and diseases that we're confronted with all their complications. So our issue and the solution in that regard is that we need to spend more time on the educational awareness programs, not only for society but also for healthcare workers, on the things that have never been they've never come across and they've never been taught in the classroom. So you would imagine confusion as a result of that. So it's a real concern. But what else can we do? Other than to pick up a spear and help the nation. So that's what we're confronted with it, as you know.
Now, Mr. Saphetha, NEHAWU has suggested that government procure other vaccines from other countries as soon as possible. And you were quite keen on Russia's Sputnik and also China's Sinovac vaccines as opposed to Johnson & Johnson and Pfizer or Moderna for that matter. Please explain to us why.
Firstly, we are not necessarily undermining other vaccines, but we want vaccines that will not disappoint South Africans because we know that the Russian one is capable, the efficiency in terms of responding to 501 V2, it will help us and others. So the issue is that we don't have to be looking only on Western. We must broaden our net and take what really would speak to our own condition while also searching for others. So the issue is we know that Russia has been attempting to talk to our government, but the doors of our government have been closed. And we're making that call to say that open up, including Cuba, and taking an advantage that we have a relationship with Russia through BRICS. So we do think that taking advantage of that relationship will not take long to secure that, because we have to take an advantage of that relationship. As you know, in Cuba, we have a historical relationship which was led by the late Baba Mandela with Fidel Castro. So we needed to explore and take advantage of relations that we established so that we speed up the securing of vaccines as much as possible as we can, and be able to meet the 67% herd immunity as expected by society.
Speaking of, for example, the Sputnik vaccine from Russia, in terms of, the regulations and also the testing that has to go hand in hand with that for our variant of the COVID-19 virus, what sort of testing has been done as far as you know?
What I know, in fact, the problem with the South African government in as far as Sputnik is the fact that they could not secure data or clinical analysis, because Russia, after having produced this, it rolled it out, not subjecting it to all these processes and so forth. So because South Africa has established statutory boards that they ought to approve. So if there's no data available for them to apply their mind, they don't regard that as a necessary thing to be used by South Africans. So that's where the issue is. And we are also saying that Russia must be open to that scrutiny, because South Africa has a responsibility as well to look after their society. So if they want to subject that, let them do so. But they ought to create those mechanisms to do so while awaiting for the delivery of the vaccine to South Africa. So so we need that as part of the engagement, that Russia also can be releasing the sample while they have concluded, and also waiting for the issues related to logistics and so forth to be testing, so that once it arrives in South Africa, we don't have to subject to this vaccine to a long process. We just, if we are satisfied with it, to roll it out. And remember, we have relations ourselves with our sister unions. We have been interacting with them, and they've been giving us good feedback in terms of how the vaccines respond. And also, as we engage with them, we don't leave the complication of 501 V2 in our own context. So our discussion takes into account which was the lacking in terms of securing the AstraZeneca earlier on, because there is no consideration in terms of our institution vis-a-vis what would have been produced by the other country who might have not experienced this.
But you do take note, and you are cognizant of the fact that there are as yet no findings that Sputnik would be effective against our variant of COVID-19.
Certainly, but when you are desperate, you have to consider anything that you are told that is helpful, subject it to your own instruments, test it. You can't risk and take it for granted and discover later that is not working. And I'm sure we have to learn lessons from the AstraZeneca for the future. So we do take into cognizance, but we must not delay. If we're going to subject things to long processes, let's double our effort and improve the speed within which we are securing this and we're engaging. That's the point that we're making, as opposed to be confining ourselves purely to a few countries, which really they are making a lot of money out of health. We say that let's go also look into those who regard health as an integral part of humanity, and they value health as a right to everyone else. So that's what really we're saying.
So at this point, as we understand it, the Johnson AD26 Janssen vaccine seems to be the one that is most likely to be administered to our healthcare workers, as per the plan that was devised, that they would be the first in line to receive whichever vaccine we received, that would obviously be effective in the country. So how do your members feel about that?
As I said earlier on, is a mountain to climb because they've lost hope. But we will not get tired. We will continue to double our effort and do our part in convincing them. And of course, Johnson & Johnson vaccine also is not going to be a vaccine that is taken and rolled out. It ought to be subjected to processes of testing and getting results, as we will have to be doing as a normal thing, as a normal trend that we have to. But we are hopeful that this Johnson & Johnson will not disappoint again. Because if it does, it will create more problems. But we don't have a choice, Sakina. We'll have to do our best to engage with our members to receive that. And also we support the plan because we need to look for anything that can help.
So, and as you stated earlier, you would like to see government actually purchase more vaccines. But at this point, is the cost factor concerned for NEHAWU?
Not necessarily, because we know that the reference that we are making in Russia and in Cuba, there will be some consideration in terms of prices, because ourselves we have been interacting with the ambassador of Russia, and that's why we're taking upon ourselves to link the Russian government with our government. I've been trying to locate the Director General of the Department of Health, so that we create, an interaction between the two, and then leave it in their hands, because it's going to be government to government, but also put some pressure to ensure that they resolve the solution. So yes, we will do our best, as I was saying, under these difficult circumstances. But of course, the price ought to be considered. But the life of our people must be valued. There is no cost for life. So we must do that.
Let me understand this, Mr. Saphetha. You're saying that you've been in conversation with the Russian ambassador to South Africa about the vaccine procurement. Is that what you are saying, and that our government is not in conversation with them?
We are saying that we have been engaging with them on the possibility of sharing what they have with South Africa, but they've indicated difficulties to find an ear to listen to them. So we're saying that we will help them to have that discussion. So in doing so, we'll have to engage with our government to open the doors to listen to people who are offering help. That's the point that we're making. We have been, and as I was saying, that I've been trying to locate the DG so that I share what has been our discussion with the ambassador, and they have to take it from there and ensure that whether they can find and can arrive in an amicable understanding as it relates to the vaccine.
That certainly is quite interesting. But even if we do get a vaccine, Mr. Saphetha, a vaccine that has better efficacy against this new variant that we are currently dealing with in South Africa, that vaccine program still needs to be rolled out. And in your opinion, is our healthcare system overall equipped and ready to proceed with the rollout of vaccines?
You see, again, I don't want to talk about the historic, systematic and structural problems in healthcare, because if we were to do that, we might end up not doing anything to save lives now. But with what we have, we've developed, because we've been participating, what government have done this time around, they've improved the participation. They've involved us from the initial stages of the vaccine. We've been participating in policy framework. We've been participating in developing programs and so forth. With the limitation that we have, we do think that we can do the best out of our ability to make sure that we serve our nation. So we're quite satisfied. We're quite satisfied with the plans that we put in place at the infrastructural, but also in terms of identification of centers for the rollout. And we do think that with that facility having put in place, we don't have to start afresh when it comes to Johnson & Johnson, but it's just to strengthen where we're weak and then be in a position to roll out, because we've been together even in identifying categories that must be prioritized as a response to vaccination rollout plan. So we with all the problems that we have, we do think that we can rise again as a country, as long as we're together, as long as we protect the resources that we have. We don't allow looting and other forms that might be destructive in the process.
So given what is happening of late around the vaccine procurement and rollout programs, you've applauded government on being transparent about the details. But what have the consultations and engagements between healthcare workers and government been like since the beginning of that acquisition process?
Look, there have been some interaction through trade unions, and trade unions interfacing directly with frontline workers, but also government have developed some programs to do so and establish a structure. For instance, 2 weeks ago, the minister had opened up a webinar which was also extended to any healthcare worker to interface with the processes and allowing their views to be heard. So it was one thing that was good out of this, and we're encouraging that to be a practice. But also we need to improve, as I was saying, on what we communicate. The educational awareness program, in our view, is very critical in terms of what this animal called 501v2 means, but also what then the vaccine is meant for. Because generally, Sakina, there are two levels of thinking, because others, they think that the vaccine is meant to prevent them from infection, others, they think that is meant for curing. Yet the vaccine is about preparing and making strong your soldiers to be able to fight against any form of a virus in a way that you don't severely get ill, and also you don't die, but you can live with the virus, because coronavirus is there and we'll live with it for some time now.
Mr. Saphetha, let's leave it there. Thank you so much for your time. Zola Saphetha from NEHAWU talking to us about the latest developments in the country's vaccine rollout with a specific focus on healthcare workers. And you heard their concerns about what is going on, and also trying to urge government to spread that net a little wider in looking for vaccines to treat COVID-19 in South Africa, especially given that we are dealing with a specific new variant.